I want to welcome our next America's Frontline doctors, Dr. Brian Tyson. Dr. Tyson is a family and emergency physician in California. He owns urgent cares, which have evaluated more than 17,000 patients with over 1,900 positive cases and 0 deaths. He has had such success due to aggressive early management of COVID-19 and now speaks about his treatment strategies to other doctors and to the media. Dr. Tyson.
Pleasure to be here in a room of so many talented individuals. I'm a little humbled because, we live in a very rural area outside of San Diego, about 2 hours east in the desert between San Diego and Yuma, Arizona. And we don't have big medical centers. We don't have fancy technologies. We don't have big labs. We have 2 little small hospitals, and we own the only certified urgent care. So when January, the outbreak in China came, and we were starting to hear about it, we started trying to figure out, well, how are we going to address this problem? Because we have 180,000 people in our valley, and just south of us, across the border, we have 1.5 million people in Mexicali. A lot of our population goes back and forth over the border. We have many residents of the U.S. who live in Mexicali because it's cheaper. We have a lot of labor that comes from Mexicali across the border to do migrant field work and manufacturing work in our valley. So we tried to develop a strategy from the very beginning. In early March, we heard about the cases out of New York and what was going in New York. And we had a little bit of a tragic story because my daughter, who's in music, her music manager lives in New York City. She was supposed to go out there for a trip, and her manager called me and says, I think I've got this. And I'm like, you think you got COVID? And he says, yes. But my doctor I can't get a hold of. I don't know what to do. I feel like I'm getting worse. I said, well, I'm hearing there's treatment. We need to get you the treatment. We need to get you hydroxychloroquine. We need to get you zinc, and we need to get you a Z-Pack. And we need to get that to you now. And he goes, let me see what I can do. Let me see if I can get a hold of my doctor. I'm like, well, did you go to the hospital, maybe the ER? He goes, yeah, I did. I just got back from the ER. They told me I wasn't sick enough. He said they didn't even want to test me. And I'm like, okay, that's not good. So let me see what I can do in California. Maybe I can get a prescription out here. Maybe I can FedEx it to you. So I called him back the next day. I said, I haven't been able to locate, and there's some hesitancy about giving out the prescription right now. He goes, that's fine. I got a hold of my doctor finally, and he says he's going to try to get me a prescription. At that point, I believe you can only get hydroxychloroquine from the hospital. So he went back to the hospital on the 3rd day later, and he called me from his room, and he says, I've been admitted. He sounded in good spirits. He goes, they're giving me some treatment. I'm on oxygen. I feel a little bit better than I did yesterday. And that was the last I heard of him. He died 2 weeks later. Sorry. So I knew we had to have a plan. So initially, we couldn't get any testing either. End of March, there was a couple of serology tests that came available through the emergency authorization use. I managed to contact some friends that I had out of LA. We found a lab out of Orange County, a private lab that did a lot of the drug testing and had some relationships with some of the Korean manufacturers. We were able to get some serology tests. We were the first ones to get testing in our area. But it was a serology test. And serology basically was just looking for immunity. IgM, IgG, we figured if you had a exposure early, the IgM would then be positive, and then, you know, as immunity progressed, we would see the IgG being positive later. But that wasn't good enough for me. You know, I wanted to make sure, and I needed to see it. I always told my wife, you know, as a physician, we need to see what we're up against. We need to feel it. We need to hear it. We need to examine it. We need to ask questions about it. And so we didn't take the approach of the telemedicine. We did everything in person. We had a huge parking lot, which the Golden Corral used to be there, and they had shut down prior to all of this, so it was good. We had a lot of space. We designed a outdoor carport into basically a outdoor clinic. We kept patients in their car. We gave them their forms. We called them up one by one. We went through them. We examined them. We did our serology tests. And something that I was hearing a lot was the respiratory symptoms. So we started doing chest x-rays. I had a chest x-ray machine in my clinic. The inside of the clinic was virtually dead because nobody wanted, even the non-sick visits, nobody wanted to come. So we started doing the chest x-rays, and we started to notice the COVID-19 pattern on chest x-ray. We didn't have any confirmatory tests. We couldn't get the nasal swabs, the PCR. I got a call from the public health department telling me I need to stop testing because I was creating too much work for them, and there was no way for us to confirm a test, so I shouldn't be using this test anyway. And I said, well, but I have a parking lot full of patients. What do I do to those patients? What do I do to the mom, the dad, the grandma, the grandpa who are looking at me and saying, we're scared to death that if we get this virus, we're going to die. And you're telling me not to even test them or see them. Like it was just unheard of. So without any options, I said, until you give me an option, I'm going to continue doing what we do. I had a feeling it was going to be a problem, but that's what prompted me to keep all of my data. So we created a spreadsheet, and we basically acted like the public health department. We wrote down everybody's name, we wrote down their symptoms, whether they had mild, moderate, or severe symptoms. We checked their age. We looked at whether they tested positive for IgM, for IgG, or a chest x-ray. And we needed to start treatment. I wasn't going to let my patients experience what my friend Gary went through. So we started treating very, very aggressively and early. And I got multiple feedback because we would see our patients back every 2 days, every 7 days, and at 14 days, because that was the guideline was the 14 days. And I would repeat the chest x-rays. We would call them, how are your symptoms doing? You know, how are things going? And those who we started on treatment early, within 2 days, everything was fine. Everything was fine. Those who had moderate symptoms, it was about day 3 to 5 where we really started to notice the difference. Those in the severity group, was the multitude of upper respiratory symptoms with a positive chest x-ray finding. We had almost 600 patients in that group. And we noticed that their symptoms would improve. However, there were some cases where we need to continue with the treatment or add on treatment. As our basically experience progressed, we started using dexamethasone. We started using nebulized budesonide. But everyone managed to recover. Like Dr. Gold said, we're at almost 1,900 positive patients that have been treated, and we've had a 0% mortality. We managed to keep our essential workers and places of business that needed to stay open. And I'm going to run you down a list of employers that we had to deal with, that we had to keep in the workforce. The Border Patrol, Customs and Homeland Security, Calapat and Centinela State Corrections, Federal ICE Detention Center, the Sheriff's Department, our Brawley Beef Cattle Factory, which produces majority of the beef across the U.S., the cattle feed companies, the migrant farm workers, the Housing Authority, construction workers, IID, El Centro Fire, Police Department, the nurses of both Pioneers and El Centro Regional Medical Centers, many of the dental offices, construction workers. I mean, the list went on and on and on. So we had to develop also a testing, screening, and return to work policy during all of this as well. So what was important for us was identifying who was sick. You know, we've heard asymptomatic patients versus symptomatic patients. We know in medicine that asymptomatic patients those aren't the ones we need to worry about. We need to identify who's sick. We need to pull them out of work when that's appropriate. And anybody who was sick automatically got pulled out for 7 days initially. I don't care what it was from, you got pulled out of work. Because what we noticed is, even though you have a respiratory virus, you spread it to somebody else, then we've got to pull that one, and the chain effect goes on and on and on. So we pulled them out for 7 days while we waited to see if their serology would then seroconvert 7 days from now. So even using a little serology test, it may have been negative on day 1, but we were noticing that those who truly had COVID were positive by day 7. And it went along with a chest x-ray. It went along when we reevaluated them at 14 days, and now they're IgG positive. So it was a way to determine, yes, now you can go back to work. We know you've had it. We know you have immunity. You can go back to work. And when patients returned to work, there wasn't the stigmata of, oh my gosh, you're going to get me sick. No, we told them, you have immunity. You're going to be fine. Alleviating fear was, I think, one of the biggest things and challenges we had to deal with. Looking a 10-year-old or a 90-year-old or a mom who has her 11-month-old in the eye to say, your result came back positive. We think you have COVID. Watch them break down in tears, thinking they're going to die or their child's going to die, and telling them, no, don't worry, you're going to be fine. You know, both my kids have tested positive. Both of them are just fine. We had 2 MAs who had newborn kids, and they worked through the whole pandemic. They're fine, and so are their kids. We've managed to have 6 staff members test positive, 2 nurse practitioners test positive, and everybody is just fine. We started scared. We ended knowing everything's going to be just fine. And we know America's going to be just fine too. Thank you.
Thank you so much, Dr. Tyson. I was present at a meeting recently where Governor Kristi Noem was speaking from South Dakota, and something she said really struck me, and she said that she was not given the authority by the Constitution or her state regulations to say what business is essential and what business is not essential. That it's simply exceeding the authority. And it sounds like, you know, right? You took that approach.
Yeah, we did. We did. And,
you took a scientific approach.
And again, it's scientific. It's something that we learned. You know, I learned what we call the OODA loop in med school. You observe, you collect data, you analyze the data, and you act on that data, and then you loop it back around and reevaluate. And I think we've missed that whole reevaluation process, you know.
Well, thank you. Thank you for keeping everybody healthy and for keeping everybody at work.
Appreciate it.